We want to start off with a reminder that we are not doctors. Before you make any changes or try something new, always consult with your doctor and medical team first. Chronic illness can vary from patient to patient, so it's always best to consult with your own doctor for what is best for you.
Hello and welcome to IBD Determined. I'm your host, Mason Harvey, and I speak from the role of a patient, and I have Crohn's disease.
And I am your other host, Michelle Harvey. I am Mason's mom, and I speak in the role of a caregiver. And we're going to have a link at the end because we used Healthline and Everyday Health for all of the resources. So we will have a link for you guys so you can find these and read through them too as well. So today's topic is going to be on something called ARFID, and that is ARFID. A lot of you may have a child who is picky. And so it's kind of like, how do you know when your kid is just picky
or
when it's
another
more?
issue.
Yeah, because with Mason, there was no issues as far as we know when he was picky, unless that is like some kind of early
Thing with Crohn's.
thing. Yeah. So I don't know if there's any studies that have been done on this to see what
New studies.
yeah, so it'd be interesting research to see what research says. But sometimes some of you may have a child that is picky. And this doesn't have to be with IBD. You can either have a child with IBD with these or without, that we're kind of starting off with here. But then it can go further. So like if a child is diagnosed with IBD, they might be avoiding food because they're associating it with pain, things like that. And so they may not want to eat. They may also not have an appetite. It's important to note that if your child is associating with pain and they don't have IBD, make sure you're looking with your pediatrician into other potential issues that are going on. And so what we're basically discussing today is going to be ARFID with IBD, just associated with that, because ARFID is actually a very large topic and it's a much bigger topic than what we can fit into any kind of episode. So just important to note that what we're talking about today is in relation to IBD. Another thing to note, if your child has any of these symptoms, we're not saying it's ARFID. We're not experts.
No.
The important person to consult anytime is your doctor
yeah.
first. Okay. So
We're
that's
just going off of sources.
right. And just to kind of inform you guys, because it might have been nice for me to know these things. I had no idea that this existed, and it's newer, and no doctors have ever mentioned it to me. It was never brought up. So I think it's just important to discuss, but I also want everyone to make sure out there that you're not self-diagnosing. If your child is not yet diagnosed with IBD, but is exhibiting signs of something we're going to talk about today with this, but it's important to find a doctor who doesn't just assign them as having ARFID, but make sure that they're also searching for underlying issues.
Yeah.
Because
they're
ARFID,
going above and beyond.
yeah, because and this is just from a parent perspective, again, not a doctor's perspective, but I think that ARFID and IBD can look a lot alike. And sometimes, they go hand in hand, and sometimes they're not the same thing. So it's just important to look for the cause and the root. And that's why it's important that if you feel like there's any symptoms, to speak with the doctor. And yeah, so they'll be better to help you than we will. So we're just here to kind of guide you guys and go over these things. So let's get into it, because yes, this is going to be yeah. Poor Mason. He's like, great. He has his first day of college tomorrow.
Yay.
And this is how he's spending the day before he gets to do a podcast. So he'll get some time off today. Yeah. So let's start off with what is ARFID. And again, that was ARFID. And it stands for
Avoidant Restrictive Food-Intake Disorder.
So according to Healthline, people with ARFID feel fear about eating certain foods or have a general lack of interest in eating, which did you ever have a fear?
No, I never had a fear of eating.
Yeah.
I just like certain foods just didn't look good to me. I didn't really feel like eating them, or I just was like, I'm not hungry right now. I don't feel hungry, so I don't feel a reason to like.
So you and so some people out there, again, this is where this disease can be different. Some of you will eat and it can create all sorts of problems, and you feel. So for Mason, that wasn't it. It was that he didn't have an app. He had the general lack of interest. And so unlike other eating disorders, ARFID doesn't typically affect body image. So this isn't something people are doing because they're worried about how they appear and want to change their appearance. That's not typically ARFID. So it can, though, it can increase your risk of malnutrition. And that's already a risk for people with Crohn's disease. That's already a problem. So you can see where there's an overlap in this disease with Crohn's and some of the
The
problems it can
symptoms.
cause. Yeah. It's a serious eating disorder that can lead to unhealthy weight loss, malnutrition, and a worsening of IBD symptoms. So this is where I think it can be confusing for people because it's like, is it, you know, which is it or which
What
is the
is it?
cause, which
Yeah.
is, yeah. So
Which
that's
is
kind of what we're
which?
going into today. And so Dr. Herrera, and that's a GI, and again, these we're going to cite where we got these sources at the end of this so you guys can find all of
You can
this.
find the
Yeah.
information and read all you want about it.
Yeah, exactly. Go a little more in depth on it.
Mhm.
But this GI explains that there's three types of ARFID. The first, usually affects children, is a kind of picky eating, like when a kid refuses foods with certain textures, which is interesting.
That's what I used
You
to do.
didn't, right? When you were like, this is the thing I talked to the doctor about because he was like, I don't like the texture. And I thought I only had one child. I saw other kids who were picky for other reasons. I thought, okay. And pediatrician said normal,
Mhm.
but so that's why you can have things. It doesn't always mean you have ARFID. That's
No,
but
no, that
it's important to get a proper
yeah.
diagnosis. So, but he was also younger, and I don't know if this was around, this diagnosis yet. So, anyways, that's interesting. So, the second type of ARFID is a lack of food drive. So, patients lose their appetite and show no interest in food, which
Mhm.
again, you're
So
two
another
for two
thing.
now. I know that's interesting, right? And so that's another
Oh
type.
boy.
And then the third type of ARFID is brought on by a fear of negative consequences. So that's what usually affects people with IBD. And so the Dr. Herrera likens it to what happens. So like when you get food poisoning.
Mhm.
So the doctor's example was if you eat some bad shellfish and you throw up and have other restroom issues and get stomach cramps and get really ill, you're probably not going to want to have
Have
shellfish
selfish again,
again,
yeah.
right? You're just going to say, "Oh, no." So that is a good
Which I
way.
haven't had that,
No.
thankfully,
No, but that's why some people do get like that. So,
which understandably.
yeah, yeah. So it's kind of like you blame that and you're like, I'm never having that again because you have associated it now with being extremely ill.
Oh, yeah.
So that happens. So, how is ARFID connected to IBD? And because we just named some of the three types, but we're going to go more into now how it is connected specifically with IBD. Food may play a role in managing symptoms of Crohn's during a flare. So we've talked about trigger foods. So a food may not cause a flare,
Yeah.
but
It
it
might
can cause some symptoms.
yeah, which can cause a flare.
Right. And so it's they're not entirely sure yet on all of this
I
about it
don't
yet.
know a lot about it.
Yeah.
Which is
So
why you should help raise awareness.
yeah, that's why we're doing this. And so anyways, so a major risk factor for developing ARFID is having an adverse reaction to food like we just talked about, having pain or having to use the bathroom. That can be like for some people who have to go to school, to work, go on a plane, different things, they don't want to have to go to the bathroom. And
Yeah, but you
so
don't wanna go on a plane or when you're at work.
yeah, or I've even heard like truck drivers, like
Oh my god.
that belong to one of the Crohn's groups I'm in, and because they're on the road a lot, they say they avoid food while they're on the road driving
Yeah.
because they don't want to have to use the
Yeah, truck
restroom.
drivers, there's, like, truck stops every now and then, and
But
it's hard to slow down every few hours if you have to go to the
right,
bathroom because 'cause you're in a
or
flare.
every half hour
Yeah,
or whatever, and then you're there for like half an hour and
yeah.
get it, so you can really so
Poor truck drivers.
some people will avoid food for these purposes who have IBD. And so many people with Crohn's disease might feel afraid of eating and they just don't want to make their symptoms worse.
Worse.
They'll try to start to track, your trigger foods, which we've discussed in other episodes. We've even made a journal
Mhm.
specifically for this. So you can figure out, ingredients that are in something. You can maybe figure out like if you have a bad reaction to pizza, which was it? Was it the sauce?
Yeah.
Was it the
Was it
bread?
the
Was
cheese
it the
pizza or
cheese?
was it the cheese and pepperoni
Yes.
pizza? What
So
was it?
you kind of have to start. Some people start tracking and trying to figure out, okay, what caused it so they can avoid it
Yeah, make
because they
sure.
don't want to be in
Feeling that
pain.
yeah.
You don't want to have
No
a
one
flare.
does.
But what happens when that list of trigger foods gets too long?
Mhm.
Like,
Then you can't eat a lot of things that
right.
you usually would eat.
Yeah. So what if somebody, like this is one of the questions they had, what if someone with IBD decides to eat only a few different kinds of food or even just stick to one? Like they think they only have one safe food. And
That's not good.
that's a sign of ARFID. And many people with Crohn's disease skip meals. They restrict what they can eat, and sometimes they don't eat as much either. Like, they
Mhm.
might eat smaller amounts. Might not be a serious problem since they're typically short-lived, but,
If it's one that lasts for a
like, if
long
you have a
time,
longer flare, that's the
yeah,
problem because sometimes a flare can last for months. It
yeah,
can last for years.
yeah, it can.
Right, and so it's very difficult to if you're gonna keep eliminating stuff, it can be very problematic, and you don't wanna become malnourished.
Then we went to the hospital, and I was still in the flare for 2 months. We were still in the hospital. When we left the hospital, I was still in a little flare. It wasn't as bad,
Yeah,
but I was still in a flare. And then probably about a year later after the
yeah,
hospital, I started going out of that flare.
right. So it was
It's
quite a
crazy
long
how
time.
long one can last.
Yeah. And so with these things, like, isn't like you were avoiding food, but you also didn't
Mhm.
have an appetite. So
Yeah,
he had to drink extra nutrition, which is important to make sure he was getting the proper nutrition so he wasn't malnourished
yeah.
because it's like from either the lack of food you're intaking or it's just how your intestines are not
Absorbing
absorbing
nutrition,
nutrients.
yeah.
So it's like a double whammy. It can be really difficult. For some people, if IB symptoms occur after every meal, some patients don't feel safe eating anything. Like, they just don't
That's not
know.
good.
So it's like the bad shellfish example we
Mhm.
gave, but like they said, for your entire diet.
Yeah.
And that's how, you can go from having a normal, healthy relationship with food and having some restrictions to be careful, and suddenly you have it's ARFID. Suddenly it's more severe. And so the
You can't just
doctor
not eat.
you can't. You
Mm,
can't. And you're not so you have to make sure you're taking care of this, and if you're a caregiver, make sure you're watching to see these signs. And the same doctor, Dr. Herrera, gave an example where they talk about a patient that was so fearful she restricted everything except iced tea because she literally thought everything else led to pain. And so it's important to use a doctor's guidance on this. And I'm just going to say, like, really quick here, like, these journals we made are really good for you to share with your doctor so they can see, what you've been avoiding, and maybe you can even share with your dietitian so they can see, like, oh my gosh, you're lacking in this, you're not
mhm.
eating this. I think it's really good insight to track everything.
That you aren't eating or are eating.
Right. So for multiple reasons, besides just trying to see if you have a trigger, it's also important so you can share with your doctor.
And
They
see if
need
you're
to
getting the
know.
correct intake.
Right. It's extremely important because of IBD. So, with that said, we're going to talk about some numbers here. So, they had told us that 92%, and these are people that have active
Mhm,
IBD symptoms, they avoided one or more foods. And so that actually seems right on to me
mhm.
because most people will talk about something they have to avoid.
Yeah, it makes
Technically, like,
sense.
you will avoid popcorn.
Popcorn, yeah. And in a flare, I try to eat foods like when I'm not in a flare, I can eat anything, but when
Yeah.
I am in a flare, we try to stop the flare a little bit by
There's a flare
eating
diet.
softer foods such as like eggs or toast or
Yeah.
grilled chicken, things that aren't as like have as much
And at
seasoning
the
or
same
yeah,
time, we have to be careful, make sure he's getting right,
nutrients,
he's
yeah.
not losing weight, and
Mm,
so we do work with his doctor is alerted
yeah.
right away, by us if we see a decrease in his weight, or
Which
any
is why
appetite
usually when I get into
changes.
a flare, I always get a 3rd, nutrition
Right,
drink.
we up the drinks like that. We make sure that we have good communication with the doctor on this, so
Mhm.
that way where he's not just, like, cutting
Yeah.
everything out and thinking, "Oh,"
I'm
so
good now.
anyways, yeah. And so, yeah, so that number seems pretty right on because many people find certain types of foods can worsen symptoms when they're in a flare, and so a lot of people know these personal triggers, and, another number they gave that is 74% of people, this is when they're in remission, not with active IBD symptoms, but in remission, they'll continue to avoid one or more foods. Now, even in remission, you do avoid popcorn.
Yes.
And I think we can talk to your doctor about that if you want it, but it's not something I
It's
think
not
you
like my
like.
favorite thing, but I think
Yeah.
if I see it, I might wanna try
So, I
some, but,
mean, it'd be
like, I'm not gonna
interesting.
go, "I want that."
We could ask your doctor her thoughts on that again, see. But so that is, I guess, for us, you fall into that 74%
Mhm.
because you do avoid, not because you've had a reaction to it.
No.
It's just because
Just
that had been
yeah.
advised to us when he was diagnosed. They're saying, though, what our reference is saying that there's no evidence to support food avoidance once symptoms have resolved as the way to go. So that's interesting. So yeah, if it's under control and you may not have to avoid those foods, but some people still do
just to be
because
safe
they to
or
be safe, or they
you
may have a fear of, so that's interesting. So Chelsea Cross is a registered dietitian, and she thinks that there's a problem, like, when you're in remission, you have, like, a PTSD. So, like, these are, like, PTSD, like, fears around new things. They worry it will cause it to come back with one bite of food. So it
I
creates.
mean, to be fair, I mean, if I knew if I thought I had a trigger and
Yeah.
I thought that might trigger a flare, and I don't wanna go back into a flare, I mean,
You know
I
how
can
bad that
understand that,
is,
yeah.
right? So you think, "Well, I could feel terrible if I don't really need to try a bite of this and then risk feeling terrible." So another study, it was the 2021 study by trusted source, found that ARFID is more likely to develop in those who have IBD, which is not surprising, to me. So they emphasize the importance of educating clinicians, and which is like the doctors, your medical teams, because a lot of them, this is still such a new concept. A lot of them aren't well versed in it and don't recognize the signs either. They're just looking at IBD symptoms, which can sometimes go hand in hand. So it's kind of difficult to differentiate. They say to make sure to appropriately screen and address ARFID and people have IBD. So if they have any suspicions of this, make sure you know how to test with this. And we'll get more into that. The same dietitian, Chelsea Cross, says that when in a flare, clients are often told nothing and left to their own devices. So if they're navigating with this alone and the client has any sort of symptoms after or around the time of eating a certain food, they just stop eating it, which makes
Makes
sense,
sense, yeah.
right? If you're, "Oh, this didn't make me feel I'm not gonna eat this again," then, the list of foods just keeps getting longer. So that's why we say it's important with these journals like we have with if this starts happening and you start feeling like you're getting symptoms from something, write it down. We have a whole page also for IBD specific symptoms, not just food, and that's very important so they can start to see if there's something else that is tying this in. Are you getting mouth ulcers? Did you have a fever? Have you been sick? Did you get a rash, you know?
Another interesting thing is if you are afraid of a food making you go into a flare for a reason that it actually wasn't the food, but it was, you thought it was because of the food. Because like, an example
Yeah,
that I could think of is maybe there was a type of food that I haven't eaten much, and then I tried it again, like, maybe I wanted to try turkey, but
yeah,
let's just say I don't eat that
okay.
much. I eat chicken more, but, I would decide to try turkey, and then there was that time I had that, infection, and
Right, which it caused a
which caused
flare,
my flare,
but if
and
you
we didn't know that,
right, but if you
and s
ate the turkey the
yeah, if
same
I
time,
ate the
you would have
turkey, I
thought.
would've been like, "Oh, I haven't eaten turkey much, so
Right, so you
maybe
think
that was
it
it,
was the
that was it."
turkey, and
Yeah.
it wouldn't have been the turkey. So, yeah, so it's important to make sure that you are tracking this so you can share this with your doctor and look at those other symptoms as well. So you're not just looking at, "Oh, I had this," but there's a whole set of questions we have, like, in our book that will help that doctor see if there's a correlation, and it's
Mhm.
not just that food or that drink or whatever it might have
Yeah.
been. Another doctor added that stress is a major component of IBD. Yeah, we all know that.
Yes.
We're very aware of that. And this doctor said it's very hard to determine, Dr. Reiser, if it's food or stress that is causing the worsening symptoms. Many people with IBD will eliminate and avoid many foods and eat a very limited diet. And if you're stressed, if you think about it, if you are stressed, I mean, it doesn't say this here, but this is just my thought process.
Yes.
If you think something's going to make you sick and you're trying it again, you're going to be
Mhm.
stressed, right?
Yeah, you're
And
right. Oh, no.
that
And that
stress
stress is gonna
may cause
cause
you
you
to
that might,
upset.
yeah.
So you may think,
Oh, no, it was that.
right, and then so people with IBD, it's not like something normal stress where we're like, "Oh, we got stressed out, our stomach's a little funny, we're fine." And it's like it could be much worse for
Mhm.
someone with IBD. So, that's kind of interesting too. So yeah, so it's like, is it the thought of having to eat the food?
Is it the stress or
Is
is
it
it the
the
actual
actual
food?
food? So I guess that's important. And so we're gonna kind of get now into some symptoms of ARFID. And again, please don't self-diagnose. Please don't, anything like that. These are
Just bring
just
this up with if
your
you want,
your
bring this up with your
doctor.
doctor,
Yeah,
yeah.
if you think there's anything in here, it might be worth mentioning. But again, no self-diagnosis
And then
here, please.
and then before you use these words, for your doctor, look at the sites. just
Yes.
to make sure and
Yeah,
research and then talk to your
being
doctor.
educated is always great. So when you do talk to your doctor, you can ask good questions.
Mhm.
And when they do give you responses or answers, you'll understand what they're talking about. So it's always good to stay educated so you can have good, healthy discussions with the doctor. And so with symptoms, so ARFID is a newly recognized eating disorder. So it's not something that is well known quite yet. I think it's getting more popularity. It's gaining more. I've heard it mentioned more in the groups I'm in, but still a lot of people don't know what it is.
It's a
And
learning experience
yeah.
for both me, I guess, a
Mhm.
little bit, and then
It is.
you.
It's me too. Yeah, because the challenge is the symptoms of ARFID and IBD, like we were saying earlier, they kind of overlap.
Mhm.
So it's kind of hard to, someone if you're diagnosed with IBD, you might not be looking for ARFID because you're just thinking it's the IBD causing this. And to be diagnosed, patients should feel an intense aversion to certain foods. And the reaction would be so severe that it affects their nutritional intake, their social life, or both.
Mm.
So that's interesting, right?
Yes.
That's something that they look at because your social life is affected too if you think you can't eat certain
Yeah,
things.
you can't go to a certain
And you're
restaurant, you
right, you're
can't
afraid that
eat.
you're gonna get sick,
Yeah.
you're gonna end up in the restroom, and so that is part of it too. That's another aspect of this. And so not every IBD patient's ARFID is obvious. IBD patients with ARFID might have a hard time recognizing that they have a mental health disorder because, like this source said, restricting food intake is a routine part of your IBD treatment,
Mhm.
right? Like
Yes.
they tell you to do that. So
Yes.
you're not thinking, I'm doing this. This is my dietitian, my GI. They all told me to do this. So it's hard to sometimes recognize it because you think you're doing
What
what
you
is
should
being
be,
asked
yeah.
of you,
Yeah.
which is really interesting, right? This
Mm.
is where this is where it's even confusing to me. It's like, huh?
And never-ending paradox.
It is. It's like, oh my gosh. No wonder it's confusing. And so Dr. Kinzinger says we tell all patients that if they have a flare up, they should restrict their diets. And if certain foods cause problems, avoid them.
Yes.
Right? So
It sounds like you'd be doing
that's
something right.
right.
Yeah.
And so many IBD patients, for instance, I like this. I wrote this, I had this one included, have popcorn, cabbage, or Brussels sprouts on their list of trigger foods.
I love Brussels
Avoiding
sprouts.
them is a reasonable, healthy thing to do.
Mhm.
Yeah, you eat Brussels
Yes.
sprouts, cabbage, just not the popcorn, which is
Yeah.
interesting. We're on
Yeah.
that list. But that so it seems so like they said, it's a reasonable, healthy thing to do
Yeah. It
because
makes
these
sense.
right, and you think you're doing the right thing. But patients practicing healthy restrictions take an experimental approach. They test foods and pay attention to their symptoms afterward. If they notice a specific food tends to bother them, they avoid it. It's logical,
Mhm.
right? And that doesn't take over their life.
That makes
So
sense.
so that makes sense, right? ARFID by contrast. So this is kind of an interesting this helped me kind of understand it a little bit better. It feels like a phobia is
That's what
what
I was
Dr.
thinking actually
Kinzinger says.
earlier, like a phobia of food.
Yes. Right? So that you already got there, right? That's
Mm.
where we've been leading up to. But yeah, you figured it out. So Dr. Kinzinger says fear is a huge underlying motivator. They're so worried about a new food, how it's going to wreck their day, that they just stick to what they think is safe, which is usually a very short list. So instead of taking a logical approach like this didn't make me feel well, not going to eat it. I think what it sounds to me is like ARFID starts to feel like they're saying you start to get a fear of food in general and of that food. And it turns into more than I'm just doing this to make sure I don't get sick to unrational kind of
And then
fears
that
about
stresses you out.
food. Right. And so some of the signs of ARFID, and these are some of the signs and symptoms. This was on the Healthline or the Everyday Health. I'm not sure which one, but again, you'll have the link so you can look. They listed at as one of the signs and symptoms is fear of the consequences of eating, which is the phobia end of it, the fear.
Significant weight loss.
A low interest in food or eating, and nutrient deficiencies. So, like we talked about, malnutrition. And a couple more signs we have: restrictive eating interferes with normal social functioning. So maybe you don't go out to eat with people because you have a fear of that eating,
Mhm.
and it's not based in reality. I guess it would be based more on what could happen, or so you start to develop a fear. That's how I take it. But that's
Mhm.
how they listed it was restrictive eating that interferes with normal social functioning.
The next one is
Dizziness or
dizziness or
lightheadedness,
lightheadedness.
because again, if you're not eating
You're
and you're
gonna
getting malnutrition,
you're gonna feel dizzy or
right,
lightheadedness because you're not getting the right nutrition.
right, it could be anemic.
And yeah, anemic or malnutrition.
Right.
Yeah.
And then fatigue, again, all that goes hand in hand. We're not discussing symptoms of IBD here, but some of these are symptoms of
Yeah,
IBD
they
too.
can go
So
together, kind
right,
of.
so you might be listening to go, "Oh my gosh, my child has fatigue. Oh my gosh, they
Oh my
were
god.
dizzy." And yes, they have lost weight, but again, that's not a sign that they have ARFID necessarily. That could be IBD.
But
So
it
this
comes
is
down to,
just
are they feel fearful of
right.
things?
And so that's why it's important to discuss this with the doctor because these can overlap as you can see. So like we are just saying, some of these symptoms are already present in somebody who has Crohn's
Mhm.
disease. Symptoms just become much worse with the development of ARFID. And I just know I've heard other parents in some of the groups I talk about there that some of the groups that I'm in, these parents will talk about how their child tells them they don't want to eat because it is too painful. And then they're worried that their child's being difficult. And I think there's cases where when that starts happening, it's important to discuss with your doctor or their doctor and make
Mhm.
sure you're kind of looking to see if it hasn't developed into ARFID, if it's beyond the IBD, if the symptoms are now causing another issue. So it's just important.
Yes. Just talk with your doctor.
And one of the things that says Dr. Burton Murray talks about is some of the less clear-cut signs of having ARFID is the social consequences.
Mhm.
So this doctor says patients may avoid getting together with friends because they're afraid to eat with them. Or maybe families are going to extreme lengths to accommodate the patient's ARFID, like you're going to 5 different grocery stores to pick up special brands of food. And I can see how this could easily happen because it's like this store has this brand of something. This
Things aren't the same,
things
yeah.
aren't the same. Like there's might be a different flour that was used by this, different brand. It can.
I feel like this it's obviously not the same thing at all, but I feel like that those 2 things could kinda be, like, tied in with a gluten or lactose allergy or intolerance,
Mhm,
because you might wanna go to a different store to get a different brand of bread, because that one isn't cross contaminated,
mhm,
because the other ones might be, and then you may not want to go to with your friends to a certain restaurant.
mhm.
A funny example would be if you had a peanut allergy or something, and Five Guys. I don't know if you know what that is, but they always had, like,
Texas Roadhouse does it
Texas
too,
Roadhouse
right?
too,
They
yeah.
both do.
Five Guys
I don't
was
think
one
they
of
still
the
do.
best.
So
Yeah,
we
but
went there last time we were all there was before COVID. That was
yeah,
like 4
before
years
COVID,
ago. So
yeah.
I don't
So long
even
ago.
know.
I don't know if they even have it,
Yeah,
but it
but
was
they
just an
did.
example. You may not
Right.
wanna go there, because
No,
it's all over the
you'd want
place,
to
and you're like,
avoid it. Yeah. You're like, "No,
so
thank
that's
you."
ARFID, but that's, like,
Yeah.
kinda
But that's interesting,
mhm,
because you have to sometimes you'll go to lengths to get things, but I can
mhm.
see how it happens where all of a sudden you're shopping, you don't even realize and you're like, "Oh my
Oh, I'm
gosh,
at 5 stores today.
this is a
Well,
problem." Well, let's talk about real quick the healthcare professionals because if you're listening to this and you're thinking, I'm confused at this point. You guys have
I don't know
confused
what's
me.
going
I don't
on.
know what is. So, and that's okay. You guys are supposed to talk to professionals. So, some of the treatment, the people they included for that would be involved in treating ARFID would be your primary care doctors, mental health counselors, speech language pathologists, occupational therapists, and dietitians. So those are some people you could seek out help on this topic. If maybe one doesn't know what you're talking about, go to
Go
somebody
to a
else on
different
the
one,
list.
yes.
Yeah, and get the help that you need. There's a few more things I wanted to throw in here too before we stop talking about it. But one of the other or one of the other statistics we got is that it's estimated that 21% of people living with IBD also have anxiety. Think that's accurate.
Mhm.
The rate of depression among those with IBD, 16%. Again, that could easily be accurate. And so when you have these mental health conditions, there is a tie to developing an eating disorder with these. So that's
Yeah,
also
anxiety.
it's worth mentioning to because I want to include that here too, so you get those other statistics and other perception of an eating disorder, like a full picture. So mental health support is really important, guys, especially if you have anxiety or depression.
Mhm.
Mason has had a therapist.
Yes.
You've had it for 3.5
3.5
years,
years.
probably almost
Close
4
enough,
years.
close enough.
Yeah, almost 4 years since your
And they're
diagnosis
very good.
is yeah. So he's been having for almost 4 years now
Well,
therapy and help with that as well. The doctor also created a questionnaire called the 9-item ARFID screen. It's called the NIAS. There's so many initials here. But that's what him so that's one of the tests that clinicians are now using to determine risk factors for developing ARFID, which I mean, I think it's important to look at the risk factors to see if you have the potential. So they said that the idea is to provide a brief survey that patients can complete, and then gastroenterologists won't diagnose ARFID themselves necessarily, But we'll see that if the patients are scoring high, it might be worth referring the patient to a psychologist or nutritionist for evaluation. So, you know how like you do all those quizzes, like so many pages.
Yes.
Every time he has to
2,
go into the
2.
doctor's.
Oh, no, way more than 2, like 5 or
Yeah,
4.
it's several questions.
Hospital. Oh, wait, before we go to the hospital, we have to go
Yeah,
through this
all he
quiz.
does the questions for his mental health.
I
He
thought
does.
I thought I only had school finals. Apparently, I have hospital finals now.
Which ones are more fun?
Yeah, it's hard to say. Probably the hospital ones, so you can get to them faster. But
Right. So yeah, so he gets a lot of screening done, and I would think this would be an easy thing to doctors could screen for in a IBD clinic. So just interesting. Maybe your doctors are already screening for this. You
yeah,
may have already heard of this. And so there is not they say there's not an agreed upon yet best method for how to treat this. But they said that the best way that they approach it is they involve 3 different clinical specialists. So a GI, which a gastroenterologist, a psychologist, and a dietitian. So the GI's role is to use medication like steroids or biologics to treat the underlying IBD symptoms. Super important,
yes,
right?
super important.
Because once the painful inflammation dies down, patients can take a more constructive approach to their diet. So for
Exactly.
you, once your inflammation got under control, that's when you start having an appetite,
Yes.
right? Like you were actually like we weren't having to tell you, hey, it's lunch, you need to
Like,
eat.
yeah, I'd be walking. I'm like, is it
Yeah, it was like
lunchtime?
10 o'clock in the morning. He's like, "Is it lunch yet?" I'm
Is it
like,
like
"Oh my gosh,"
okay?
you know? So the next one is the psychologist, and they'll typically recommend like cognitive behavioral therapy, and they have relaxation exercises, coping strategies to get patients to start thinking around
Mhm.
their food, to change their thinking around their food. And then under a dietitian, they'll start doing something called like exposure therapy, which is the gradual reintroduction of foods. So probably not to freak people out too bad,
Yes.
right? Like to get that
Yeah.
build that confidence that you know you can eat this, and then if you do have a reaction, okay, but you're doing this with the help of a dietitian, which is really important. So like they may do one food at a time. They said like a slice of apple or a glass of milk. Then the patient will just see how the food sits with them, and they can keep scratching things off the list. Like, no, that didn't bother me. So it might make you feel more confident to do that with a dietitian. And so I'm just going to throw it out there one more time. Our journals are helpful
Yes.
for this. And this is why we use them for Mason. So that way, when the doctor says, what has he been eating? How many calories? We have it at our fingertips and we can say, well,
They always
this
see
is
what
what
they
he's
eat.
been eating. And also over here, these were his symptoms related to IBD.
Mhm.
So we can look at the full picture. It's very, and also looking at the restroom
And I can
journal.
see what you do eat or don't eat and what you're excluding from your
Mm,
diet.
Yeah.
So,
Because that will make a lot of sense as to
mhm.
why you may have certain symptoms. So that's I think those food journals are extremely important. And like I was going to say, the restroom journal is also important though to see how reactions are when everything comes out, I guess. So I don't know. So yeah, I mean, it's important to look at all the symptoms to see like, is it just making your stomach upset or is it further issues? So that about wraps up our discussion on ARFID. Again, we could talk about this forever and we don't have the time and
Next
nobody will listen to
podcast.
our podcast. Yeah, nobody's interested in hearing
Well, maybe
hours and
they
hours.
are.
I mean,
Maybe they are. There must be
maybe.
some person out in this world that will be
Yeah,
interested.
hopefully they've subscribed
Scientists.
to us,
A
and then
scientist, yeah.
yeah, and so you guys can read. We're gonna have the articles for you guys, where you guys can read more about
Down
ARFID.
in the comments.
Yep, it'll be
Down
down
in the
in
description.
the
Yes.
description. Yeah, down in the description. And so in the meantime, you can follow us on Instagram, Team IB Determined. And then you can also listen to us on places like Spotify, iHeartRadio, Amazon Music, Apple Podcasts, and YouTube Podcasts. And if you want to
To
watch
watch us,
us,
you can go to YouTube.
Mhm.
And if you already are on YouTube, make sure to like and subscribe. And if you want to be notified every time we post a video, make sure to hit that bell. So hitting that bell
Yeah.
will tell you every single time
It'll
we
just
upload.
ensure that. So
Mhm.
so subscribing is great, but then clicking the bell also helps.
Yes.
So yeah,
And
so
also feel free to leave a comment. We love
yes, because
comments.
again, I know some of you listening may not agree with some of this, or you may agree with it. You may have your own experience with it, and it would be great for us to hear that
Mhm.
because again, we were not trying to be the experts today. We're
Yeah.
just trying to get you guys educated and
Yep.
show you the resources. And maybe you heard this and you're like, a light went off. Like this makes sense. There's
And if
more of
you
an
are a
issue
professional
here.
on this, I don't know, leave a comment about something we missed. If
Yeah.
we did.
you can come on our podcast
Yeah.
and you can
Mhm.
tell everybody.
Leave a comment and tell us what you
Yeah.
missed, what you liked about today's
Bill,
episode.
be wonderful. Help us
Yeah.
out. So that's it for our podcast. We'll update you guys next week on how Mason's first week of college went.
Yay.
Yeah, I know. Hopefully you'll be still
I,
smiling.
I was just like, you hear a week of college and you're like,
I know.
oh,
I know.
oh.
But we'll see
Yeah.
how it goes. Stay positive,
Yes.
and we'll update everybody next week.
Say
So
IBD determines.
yes, yeah, take that with you to class.
Yes.
That attitude. So, all right, guys, have a good rest of your day,
Yeah.
evening, morning, whatever it is. Week,
School break, summer break, yeah.
college,
Summer
week,
school, I don't know.
any of that. So, we will see you guys next week on the next episode. Bye.
We hope you will stick around, tune in, and reach out to us with your own journeys. We are excited to give you an inside view of what it takes to be a caregiver and what it's like to be a patient.
And most of all, we hope you'll maybe be able to play something you hear on here that might help you in your own life. Sometimes life changes, and it's all about how you handle the journey.